Hi, everyone. Thank you for joining me, and a huge thank you to Amazon and AWS for asking me to present my story today. My name is Melissa Hall, and I'm a nurse practitioner, as well as the Chief Information Officer here at Calvert Health Medical Center. I've been in the IT world for about 15 years now, and I'm here today to share with you our journey to achieve a higher level of resiliency as it relates to Calvert Health Medical Center. But before I get too deep into my talk, I did want to thank Hector, Monty, Catherine, Jennifer for assisting me with putting this presentation together. And I hope you all enjoy learning about my organization's journey to being more resilient. So Calvert Health, here's our mission and our vision. We are a rural community-based organization with about 110 beds. That includes emergency department, inpatient, observation, behavioral health, family birthing center, and some ambulatory practices. Many of you are probably aware of rural community-based organizations. But for Calvert Health, it's really a challenge to keep this designation while providing high quality care. And for those who are not aware, Maryland is a quality value-based state in that our budget is decided at the state level, and we adjust our rates according to our census as long as we don't extend beyond the budgeted amount. And so the state regulatory body, which is the HSCRC long name for Health Service Cost Review Commission, actually negotiates the Medicare and Medicaid rates for the state for all Maryland hospitals. And it was established in 1971, and I'm pretty sure it's probably safe to say that it was Maryland's way to ensure that we stay resilient by leveraging value-based payment methodologies across all payers. So, here's the numbers of Calvert. And as a company, I have to say that, we are the largest nonprofit employer in Calvert County, and we're committed to helping our community get high quality health care. There are actually two other large employers, the Calvert County Public School District and SMECO, which is the nuclear power plant. And we partner with many of the larger institutions around the DMV area like Johns Hopkins, MedStar, University of Maryland, and George Washington. And this has really helped us to ensure that our community has access to the care they need in the time that they need it delivered. We continue to maintain our independence as a standalone hospital by establishing these strong partnerships with other organizations. So where are we? So let's kind of get an idea of where we are geographically. So I said we were in the DMV area. So the DMV area is the District of Columbia, Maryland, and Virginia, where all three entities kind of intersect. And so it's called the DMV metro area. And Calvert County is actually a bedroom community for the DMV metro area. And to help put our location even more in perspective, we are the smallest Maryland county in land area with 213 square miles. And the peninsula is about 9 miles wide at its widest point and 35 miles long. We are about 35 miles southeast of DC, and the main road that actually runs through the county becomes Pennsylvania Avenue when it crosses into DC. So one thing, as all of us have learned, is that COVID has really pushed us all to be more resilient in how we approach our everyday lives. And this is especially true in healthcare, including Calvert Health. And one thing is our location of being on a peninsula means that we have limited ways of bringing the world into us. They either come from the north, the south across the bridge, or in the middle, there is a bridge. So, my previous boss used to say we are one drunken backhoe operator away of losing the internet. And, he was actually right because during road work in the county, they actually cut the internet connection, which led to multiple people in the county losing their internet. Here at Calvert, though, we're lucky because we have redundancy in our internet connection with the understanding that, both lines do come in through one pipeline. So recently, we partnered with our telecom vendor to implement an on-site backup that allows us to have more stability when we fail over from one of their location data centers to the other. So we actually have connected to one of their data centers in Massachusetts and one in Arkansas. So due to our location, whenever these failovers would happen, we would experience a delay. So this new piece that we've put in actually allows to decrease some of that delay and so that we can maintain connection. So when I did this quote about electronic health record downtime, we had not really experienced a significant downtime at our organization, but I'm sure many of you did as well. But the thing that the Kronos downtime showed us was that in an organization our size, any integrated application is critical to our internal operations. And although we were able to pay our employees, the impact to the downtime was felt by all for weeks. It took a long time for us to recover. So prior to this implementation with AWS that we just did, all our other disaster recovery options were at the 48 to 72 hour RPO. So, we're here to talk about resilience today. So, yes, we need to be more resilient as an organization, but we've learned that that includes people as well as technology. And being a rural standalone hospital means that we don't necessarily have a lot of options when it comes to different specialty providers. An example of this is when the lone neurologist in the county recently passed unexpectedly. And, the result has been chaotic as the office, the hospital, and the community tries to determine where they're going to get the health care they need for this type of treatment. So this recent event has led us to look closer at all our areas of coverage and determine how we can be more resilient when it comes to patient care. For Calvert Health, that, resilient also means that, we want to try to get our recovery point objective, our RPO, and our recovery time objective, RTO, as close to each other as we can. And yes, I know this is the goal of a lot of organizations, but I think it's important to point out that as a standalone hospital, this is, a goal that we really feel like we have to achieve. So all healthcare is definitely facing challenges everywhere, and some of those places are clinical and care services, operational, financial, legal, and reputational, which is pretty new. So all of us, are pretty much experiencing the increased costs of cybersecurity insurance and increased requirements for that coverage. This can be a difficult topic to explain to your board of directors when presenting budget impacts. And getting them to understand the complexity of that coverage and the results of implementing the requirements can definitely be a challenge for all of us. So, when we're looking at all these pieces and everything, there's also a compliance piece. And for Calvert, we actually conduct an annual recovery test to help ensure that our EHR vendor can actually access the system and ensure that they're able to validate the system in case of an attack. So this requirement is part of our annual security audit, and we rely on the vendor, healthcare triangle, and our teams to help ensure that, everything is being replicated appropriately. So, but you may be wondering, why do they only do it once a year? Well, that's actually because of the EHR vendor. They have very limited availability because they're trying to do so many hospitals. And so getting the testing session scheduled is actually the biggest challenge of it all. So, you look at this and you try to think, why go with AWS? And so, we actually decided to expand our usage of AWS and Healthcare Triangle's option because, AWS in the past has proven itself to make data security and resilience a high priority. All right, our non-Meditech environment is actually being backed up by AWS now, but it has an RPO of 48 to 72 hours. And it's using AWS backup, which is different than what we're using in our Meditech environment. So although we have yet to use either of these options, it just made sense to use AWS to help us achieve this higher level of resiliency. And our organization, just as many others, is definitely very dependent on the EHR to help deliver safe and high quality patient care. And not having access to patient data, can cause frustration on both sides of the aisle. So looking at that, due to the location and everything, we do try to keep our environment as hybrid as possible so that having our DR option in the cloud actually made sense because I have a very small team, about 29 employees, and their ability to monitor and interact and having that time to do that on a daily basis is just not feasible. So this is actually very important to us. And the biggest value I have to say is that, now we have a system in place that allows us to RPO within 4 hours in case of a disaster. That's invaluable. That's invaluable for a standalone rural hospital. And, it made the decision when we were discussing the implementation be a very easy one. So AWS Elastic Disaster Recovery Service, it's a newer one that they have, not like we have in our other environment. It allows for a non-disruptive replication. So my team was actually very impressed when testing the option because the system looked just like Meditech and it was very current with the data that was being replicated. It's also important to note that, it was very non-disruptive because none of the end users even know that the replication is taking place. Meditech is very sensitive to latency. And many times when data is being replicated for other applications, it starts to show the impact. And in this case, the system continued to process at its normal speed. Everyone continues to deliver care, and no one even knows that this is happening except us on the back end. So here's the architecture. And one thing I want to note about the architecture is that on our side, the Calvary Health side, it actually consists of 100 plus Meditech VM servers. Now, when I think about implementing something like this, I think, oh, it's going to take forever because of so many servers, but it actually did not take as long. AWS and Healthcare Triangle, with their assistance, we were able to get the system up in a little over 3 months. So that was really invaluable to me because our previous solution took almost twice as long to get into place and validate. And for those of you who work in healthcare, you understand the sensitivity of the work that we do with our technology. And, not being able to access the patient's record in a timely fashion means that the care could be delayed, or we won't have as many checks and balances in place that we usually have when the system is up and running. In the past, prior to technology, we clinicians would complain that technology increased our workload. But now, of course, when it's not there, we complain that we have increased workload. So technology really does mean that the clinicians, the staff, and patients report increased satisfaction when the systems are working as they should. And, this system really does help us ensure that we return to service as soon as we possibly can. So, here we have the backup and we talk about all that we're doing, but I really cannot reiterate enough that when my team tested this system for the first time, they were really impressed with the timeliness and the ease of reviewing the system. In the past, they had to put aside some of their expectations about what they were going to see and what the system would actually look like and how it would work. So having the data be as real time as possible also meant that they were not trying to look back on a patient that may or may not still be in the system. So, historically, backups have been done on premises within a corporate data center, utilizing backup software from backup vendors, media servers, and dedicated backup appliances. But AWS has now, they're offering a modern and cost-effective approach that provides a cloud-native model with the AWS backup as a fully managed backup service that makes it easy to centralize and automate data protection and the backing up of the data across all of AWS resources. So, we are trying to achieve resilience as an enterprise, even here at Calvard. And we have learned that it is needed everywhere. And so, you can see here on this slide that there's a lot of different areas that actually need it, but this could be overwhelming. So it's important to focus on the critical path, and we'll take a closer look at a few of them. But I think we all can agree that one of the things that we can always keep in mind is that we protect the network, we protect the data, and we protect the apps. And making those three things and their resilience and protection is a critical must-have. But as everything, can't forget this pandemic, and how it has taught us a lot about where we need to be resilient, including people and supply chain. So we actually had some research conducted by the Boston Consulting Group, the Henderson Institute, who suggested that organizations build a resilient business model based on the principles of biology. And so a resilient biological system would exhibit 6 characteristics. That's redundancy, heterogeneity, modularity, adaptation, prudence, and embeddedness. Now, these can be applied to almost all businesses to help them maintain resilience, by adapting to, unexpected events and then optimizing efficiency. So for Coward Health, I would say this is especially true because we have multiple systems in place in order to support the enterprise as a whole, and being able to ensure that our enterprise is resilient means that, we have a much better implementation of our organizational mission and vision. So this is a really, good quote from the Red Cross about how to, look at disasters and how we need to try to handle them the best way we can. So I would say that when looking at the AWS service, you consider this a win-win situation. When I made this presentation to my boss, I made sure to point out how beneficial it was to the clinicians and patients to have the data backup and usable within 4 hours. On the front end, AWS actually assisted us with funding, and that really helped this decision move closer because I actually did not have to present to the board for their review because there was no upfront cost. And that actually helped us fulfill what we were trying to achieve here. And since we've implemented, like I said, my team and many other executives have expressed a relief that we have actually improved our resilience as an organization. So AWS offers a few other options, of course, to help companies address their resiliency needs. But I'd like to leave you with one last thought. So AWS and Healthcare Triangle, they were able to put together an elastic disaster recovery-based solution for us that actually, significantly improved our DR posture. So through this option and this solution, we were able to effectively meet our RPOs and RTOs. And it also enabled us to restore to a point in time that has provided us with an added layer of protection against malware and ransomware. And I think that's vital. I think it's vital for our organization, as we continue to try to provide high quality patient care. So I want to thank you for your time today. And I really do hope you've enjoyed learning about Calvert Health's journey towards improved resilience.